My name is Deichman. I am a chiropractor in Brick, New Jersey. I've been practicing for about 17 years. I got into chiropractic through my father, who as a kid suffered from really severe asthma, and his parents and his uncles and stuff, they took him to a whole bunch of different doctors. Nothing helped out, and he went to a chiropractor and he got amazing results. So he got adjusted his whole life. He had kids and he brought us to the chiropractor, and I always kind of grew up pretty healthy. I feel like I did good in school. I got good grades in school. I played a lot of sports, and that's how I got into it. I knew at about 15 I wanted to be a chiropractor. I really wanted to help people, and that's the goal of me of being a chiropractor, was always to kind of help people. And my chiropractor, I loved his lifestyle. I loved how he lived his life, how he wanted to help people. I loved his schedule. I loved that he was into working out. I loved how he was into healthy eating, all that sort of stuff. So that's how I got into it. I was lucky enough to go to chiropractic school pretty early. So I got out of school early, and like I said, I've been doing this for about 17 years. I think it can be life-changing. I think the biggest thing about chiropractic is allowing the nervous system, which controls and coordinates everything in your body, to function at 100%. For me personally, it's the easiest thing that you can do to actually increase your health. Not that changing your diet's a hard thing or doing anything else, but when you see a chiropractor, you lay on the table and you have a guy or a girl basically press on your back and physically can change your whole chemistry in your body and change your life in one visit. So that's, for me personally, that's why I think everybody should get adjusted on a regular basis, or stop in or get their spine checked. You know, a lot of people think chiropractic's just about back pain and everything else, but it's really not. It's really about affecting the nervous system, and we use the spine as a lever system to basically to adjust the nervous system, because the nervous system, what that does is that controls and coordinates everything in your body. It's the electrical signal of your body. So your brain sends a signal down your spine, or down your nervous system, and your spine basically houses and protects that, and that goes to everywhere. So when you're out of position, that signal's just not getting clear where you should be. It's either distorted or it could be increased, and when you get adjusted, it just allows that to function at 100%. And it does affect everything. It affects your eyesight, your hearing, your immune system, your hormones. Everything is controlled by that. So when you're out of position, or subluxated as we call it, you're just not functioning as you should be. So again, for me personally, easiest thing that you could do is lay on the table, have a guy or girl pressing your back a couple times, and really get your spine functioning properly in your nervous system. So there's a whole bunch of stuff that we hear as myths. The biggest and first one is, a lot of people say once you go, you constantly have to go. That, you know, you go once, they're going to loosen your spine, you're going to want to get adjusted all the time, you're going to feel that. It's totally not true. Actually, getting adjusted potentially could actually make your spine tighter, because if you think about the bones being out of position and we adjust and move them back in position, you could be a little bit tighter. Not that your spine's going to get tighter, but the vast majority of people come in for some kind of pain, and what happens is they usually feel better from the adjustment, right? The pain usually starts to go away, but our goal as a chiropractor is not to reduce pain. Our goal is to get your spine functioning. Once your spine's functioning better, pain naturally goes away. So what happens, though, is once the pain goes away, people usually notice that they feel better in other areas of their lives, and they like to get adjusted. So that's why people come in. It's not like if you get adjusted that you always have to come in. And the way that my practice is, I'm pretty laid back. I have a lot of people that come in for pain, get a couple adjustments, and I never see them again till they're in pain. I have people that get adjusted, and they like to get adjusted on a regular basis. Sometimes that's, and again, I'll always give them my opinion in the beginning to basically what I think needs to happen as far as how often they should get adjusted till we correct their spine or get their spine functioning. After that, it's really up to you. Like I said, I have some people that come in weekly. I have people that come in once every 2 weeks, once a month, once a quarter, once a year when they're in the pain. It's really up to you. But in the beginning, yeah, we do kind of see you. It's a process, right? And I try to explain to a lot of people that it is a process to get adjusted, right? For the vast majority of people that have pain or it develops, it's usually not something that's very acute. It can be, right? Like a car accident, we know that, a slip and fall, that can be acute. But the vast majority of people that come in with some kind of pain, it's usually in an environment. In other words, it's something they're doing on a regular basis, their job, being a mom, being a dad, picking their kids up, doing something like that. It's that repetitiveness of nature is really what starts to wear you down. And what happens is your spine is the greatest compensating machine ever. So what happens is you basically have bad posture. Your spine's going to compensate so that you can continue to do the work that you're supposed to do without pain. But it gets to a point that it can't function anymore. And then there's usually the proverbial straw that broke the camel's back. And that's, picking dog food up the floor or doing something. A lot of people think it's that one thing, but really it's not. It's the 1,000 things that you've done before that, and then all of a sudden you do that. That's the trigger. That's when people develop pain, and that's when they kind of seek care. So for us, what we have to do sometimes is get back to the root cause, and sometimes that's why it takes a couple adjustments, and that's why it's a process to get adjusted to really get that spine functioning properly, allowing that nervous system to function at 100% and really get, for you to heal and feel better. So we adjust all sorts of people with all different pain complaints, right? A lot of people, it's neck pain, back pain, sciatic pain down the leg, pain into your arms, like any of that sort of stuff. That usually what motivates people. Sometimes we get people with vertigo, we have headaches, digestive issues, that sort of stuff. And most of the people that come in are referral based. So, somebody's had a good experience here and says, hey, in talking, they'll say, oh, I've got this, and they'll say, hey, go see my guy, go see this, and come get adjusted. So basically any kind of complaint you can come in with, we're not going to focus on that, again, because we're going to focus on the nervous system. But what you're going to see is all different types of complaints, asthma, allergies, that sort of stuff. But the vast majority of it is pain kind of complaints. When you walk in the first visit's usually like the longest visit. We'll go over your history. We'll find out what your lifestyle's like. We'll find out how long you've had the pain. We'll find out all that sort of stuff. And then we give you the adjustment. The adjustment process is not super long. I'm an old school chiropractor, meaning that I do believe that chiropractic should be hands-on only, and that you're going to lay on the table and you're going to feel me basically move your entire spine around. No matter if you have low back pain, mid back pain, you're going to feel me adjust your neck, your mid back, your low back. You're going to feel me adjust all that sort of stuff. So we focus on all that. As far as price goes, we take most major insurances. The ones we're in network with ours, Blue Cross Blue Shield and Medicare. But our prices are that people can afford this, right? So a lot of people think that their insurance is the greatest insurance, but a lot of insurance really doesn't cover chiropractic. People have crazy deductibles. Their co-payments are $70, $80. The way that I work is that I want to basically have access to everybody. I want your last reason to come see me is that it's a financial issue, right? That's really, I don't want that. I want to try to erase that. So the most your out-of-pocket first visit is $50 a visit. That's what we do right now. It's $50 a visit. If your insurance doesn't cover it, that's what your first visit is going to be. And then after that, it's $35 a visit. That's what we charge on a regular basis. There are people sometimes that you have to come in on a regular basis in the beginning to kind of get that corrective care. If it's unaffordable, we always make it affordable. I've never turned anybody down because they couldn't pay. I've turned people down that said that, oh, we can't pay. And then, I'll say, look, you got to get in here 2 to 3 times a week, and they don't follow my care plan. They're not taking it serious. Then I don't actually extend that to them where I say, hey, come in here and do that sort of stuff. So like if you're serious and you think this is going to help and I think it's going to help you, the last reason I want you not to come to my office is because of financial hardship or any of that sort of stuff. We're here to basically help. Again, I got into this to help people, and that's kind of what we do. It means that we're not going to give care away. We have to we have overhead. We have to charge people that sort of stuff. But, I don't want anybody not to come to the office because of financial reasons. So a lot of people say, look, well, how long initially does it take? Usually the longer you've had the problem, the older you are, the more unhealthy you are, the more it takes for your body simply to recover. But the other thing that a lot of people get turned off by with chiropractors is that you go on your first visit and the chiropractor will say you need 40 visits, 30 visits, 20 visits, 15 visits. I think that's all bullshit, to be honest with you. The reason why is everybody responds differently, and a lot has to do with again, your lifestyle. If you're smoking cigarettes, you hate your wife, you hate your job, and you eat McDonald's every day, you're not going to recover to somebody's that, does yoga, stretches, has a love of life, eats healthy, organic food, exercise on a regular basis. So the way that I like to work, and I think I am a little bit different than a lot of chiropractors, is on your first visit, I'm not going to tell you any of that sort of stuff. I'm going to say to you, look, let's get you on the table. Let's see how you adjust. And we'll be honest. I'll say to you, look, you adjusted really good. I'll see you next week, or maybe I'll see you again this week, and then we kind of come up with a game plan how you feel. If you adjust terribly, I might say to you, look, you might get adjusted 2 or 3 times a week for a couple weeks, but everybody's an individual. I honestly feel a lot of chiropractors that do give these giant care plans, it is basically a business decision. It's, hey, this, and this. Again, I'm not like that. I'm pretty laid back, and we're going to tell you, hey, this is what I think. I think everybody should get adjusted on a regular basis. I have my whole entire life because I feel like the more that you're in position and aligned, the more that nervous system functions better, the better human you are. But everybody's not into that, and I don't expect that, and I don't have to have that. In the beginning, I always try to again say new patients, work with me. Let's do this sort of stuff. I'll give you recommendations, but I am open. Some people say, hey, look, sometimes I think I need a couple more adjustments, or other people say, look, I feel pretty good after 2 adjustments. I'm going to wait, but you'll never hear me say, no, I don't agree with you, because ultimately, you know more about your body than I do. You're living in it, you know that sort of stuff. What I'm going to tell you is my opinion based on my experience and how you adjust, and then kind of we go from there with that stuff. The first thing I think is that I do want to truly help people. I think I'm authentic with that. I also feel like a couple things. I feel like, again, I am an expert adjuster. I feel like I pride myself on my technique and what I adjust. I don't have machines. I don't do that sort of stuff. Not against that, but that's more therapy based. If I think that you need that, I'll send you to a therapist. I'm not having acupuncture here. I'm not doing that sort of stuff. That's completely different. I'm a straight chiropractor. I think that off the bat sets me apart. A lot of these other guys do modalities, do all this other stuff to try to make you feel better. I think sometimes to line their pockets, to that sort of stuff. I pride myself on caring for people, being passionate about it. I pride myself on my technique, my adjusting skill. I also think that we're super affordable, that sort of stuff. Again, I never turn anybody away financially for that sort of stuff. And we generally care about people. I also feel like if you're not going to be a good fit for my office, or that you're not going to respond well to chiropractic, that we will refer you out. That I'm not going to be one of those guys and say, like, oh, you never see an orthopedic, or I'm 100% against surgery, or I'm 100% against drugs. Not at all. I think they all have a valuable part of this whole medical system. There's a lot of things that I disagree with certain things. I think too many people are too quick to rush to surgery, or that thinks drugs are going to fix anything. And I'm not against drugs. Drugs are great for reducing pain in emergency type situations. So I'm never going to, bash you for that. I get a lot of patients that come in here that do like the fact that I'm not going to give you a care plan of 40 visits off the bat, that I'm not going to give you, a hard time if you're taking Advil or doing that sort of stuff. That's a personal choice. And as long as that you and I are on the same page, that that's not really fixing anything, and that you don't have pain or misfunction because you have a lack of a drug, right? A lot of people come in here and say, yeah, well, I take the Advil and the pain goes away. Well, it's not a lack of Advil that's causing your pain. It's something's wrong. Pain's telling you that there's something wrong. Let's try to get to the root of the problem and fix that. I'm not, against any of that sort of stuff, but I'm against it if you think that's going to correct you. So we're definitely, as chiropractors, we always look as the body has the full potential to heal itself given the right environment. So what that means is that, will chiropractic cure everything? No, not at all. Right? Because it's only one part of the system. Having a clear neurological connection, I think, is the best thing ever, because that makes all your systems from your brain to be functioning 100%. But if your lifestyle, again, if your environment is really not functioning well, you're not going to do well. Again, if you're smoking cigarettes, eating McDonald's, and stressed out, you don't have that potential. You don't have the good nutrition, the quality for those cells to actually repair themselves. You will get better, but you might not be the best that you can be. We're all about getting your body to function at 100%. That's what makes us, I want to say, different than every other profession, is that we're all about how you function. We're not trying to reduce symptoms. We're not trying to reduce pain. We're all about how you function on a regular basis. When you do come in, again, we do an exam. We'll go through your history. We'll make sure first that it's safe to adjust you, as far as like you don't have anything major, open fractures, past surgeries that would contraindicate getting adjusted, rods, pins, that sort of stuff. That being said, even if you do have that stuff, we can work around that, right? We wouldn't adjust into that area, but we can work around that. So that's the first thing. We have to make sure that you're safe to get adjusted. And I've been practicing a pretty long time. There's very few people that I've ever turned away from getting adjusted. Most people can get adjusted. I always tell people, if you have a spine and you're alive, that's probably the 2 biggest things to getting adjusted. Again, if you have surgery, there's certain areas we can't touch, but it still is beneficial. So the process starts with, we do the exam, we make sure that you're safe to get adjusted. The second thing is we try to explain everything so that we're on the same page. You know what to expect. Again, other people that have been to other chiropractors, I still like to explain it because a lot of chiropractors get this wrong. Don't explain what chiropractic is, or don't actually even adjust. That's the other thing that makes us different. When you're at a chiropractor, you'll know that you get adjusted. I've had people before where they'll come down and they'll say, oh, I've been to the chiropractor, up in North Jersey, and I'll get them on my table and I'll adjust them. And they're like, whoa, what the hell was that? They never have gotten adjusted. They've gotten rubbed and tugged and potions and lotions where we don't do that. You're going to feel things pop, quick, and move. So I'm going to do that. We're going to get that. So once we're on the same page, we explain what to expect. Then we get you on the table, and then you kind of get used to me, and I get used to you. In other words, what happens is we'll stretch out a little bit, and in the beginning, we're not going to go crazy. I'm going to adjust you as what I think you need and you feel comfortable with, but you're going to feel me lean on you, but you definitely will feel things pop, click, and move, and we do adjust the full spine. Some people, especially new patients that have heard horror stories about, don't adjust my neck. We don't have to adjust your neck on your first visit or that sort of stuff, but it is vitally important to adjust your full spine. Another myth I've heard is, chiropractors cause strokes, that you're going to stroke people out. It's totally not true whatsoever. I like to say this to all my new patients that are worried about strokes or getting hurt. I've been in practice for 17 years. My malpractice insurance is less than $3,000 for the entire year. The reason why is we just, as a rule, as a profession, we just don't hurt people. It's just not what we do. And if anybody knows anything about insurance always assesses risk. Our risk factor is extremely low. Going back to the stroke, if you're going to have a stroke, more people stroke out getting your hair washed. It has to do with not with the adjustment. It has to do with that you had a pre-existing condition, and just turning your head in that position kind of has caused that sort of stuff. So that's another myth. So once you're comfortable with the adjustment and what we're going to do, then we perform the adjustment. You're going to feel me lean into you, push on you. Hopefully things move. We will get some movement out of you. It's a quick procedure. It's not a long procedure. It's in today's age. I don't want you in my office for 45 minutes. I don't want you in for an hour. Some other chiropractors, again, you'll lay on the table, you'll go, it's a 45-minute adjustment, they put stim on you, they put pads on you, they do massagers, all that sort of stuff. Again, that's all therapy-based stuff. I like to say to people, you can do that stuff at home. You don't need an expert into that. I'm an expert in adjusting your spine. That's what we're trained in school for. That's what we're really good at. I pride myself on that. So all that other stuff, again, modalities, that sort of stuff. So once you make that adjustment, it is a quick procedure. And again, going back to why I think it's the best thing you can do, it's the easiest thing to do to change your life, for you to function better, is kind of laying on the table and getting an adjustment. So there's a whole bunch of stuff that we've seen as far as like results. There's all crazy things where I've had people where we're adjusting their spine, and we find out later that people have heart arrhythmias, and their heart arrhythmia went back to normal, into a normal pattern. We weren't trying to address that at all, but sometimes people that work on trains, they have normal physicals on a regular basis, and they'll come back and say, hey, Dr. Jeremy, it's kind of crazy. The only thing I've changed in my life, I started getting adjusted and my heart beats faster, or it beats at a normal rate, how it's supposed to. So that's always powerful. I've had kids where had chronic ear infections, and they were talking about tubes, and eventually even I've had a kid before where they were going to put a hearing aid in his ear, and a couple adjustments, his ear drained, and he didn't need any kind of hearing. So for me, when the kids respond well, I think that's always amazing. We get a lot of babies that have chronic stuff, or they're colicky, and a couple adjustments, that'll happen. Kids that are constipated, they'll get adjusted. I've had kids where they got adjusted, had to run to the bathroom and go use the bathroom right away in my office. For me personally, I like the kids. But again, that's always... I think that's more egocentric for me to look at, what's my best experiences, that sort of stuff. I think just a normal person coming in on a regular basis, adjusting them, I think that's the coolest thing ever, because there's so much stuff that we don't know that could potentially be wrong with them because we haven't had a symptomatology yet, that we prevent that by adjusting them. So that's the cool thing. I've had, tons of people with sciatic pain go away, pain in their hands go away, numbness go away. Again, eyesights have gotten better and hearing's gotten better. Those people never came in for that. And same thing, blood pressure has dropped. They never came in for that. It was just an added benefit of, again, allowing the system to function better. Funny story that always people, and it was funny, I had patients yesterday ask me this, is about passing gas and farting. Does that happen? Yeah, it does. Probably at least once a week. It's a normal thing. And when you're a fledgling chiropractor, it is kind of awkward. It's a little bit funny, but everybody does it. I guess my funniest story is some of the older people They have no qualms about it, and they'll tell you that they're going to do it, and it's going to happen. And I had a lady, and I can talk about it now because she's since passed. She would come in, and she kind of do it on a regular basis. And she said to me, and it was the funniest thing I ever heard, was I adjusted her. She kind of let one go and said, "Oh, I shouldn't have had Frank and beans." It's the only time I actually had to leave the office and kind of say, I got to, take some time to myself, and you come back when the room cleared. But it's not a big deal. I love people. Nothing bothers me. I get a lot of patients that are nervous coming in from the gym, or I've got guys that do construction and they don't want to, come in here right when they're sweaty and that sort of stuff. But we work with everybody. I always tell people, come in, because a lot of times when you go home, you don't want to come back to the office. So don't ever worry about any of that sort of stuff. I'm never worried about that. I did a mission trip to India my last year in chiropractic school, and I feel like that prepared me to get used to basically adjusting people, lots of people in all sorts of settings. We went to some of the poorest areas, so you have some of the people not with the greatest hygiene, but again, we just love all that sort of stuff, and I feel like I'm a people person, so none of that stuff turns me off. All right, so what we're going to do is we're going to check your spine, and we're going to check for alignments. So there's 33 individual bones in your spine, and what we do is we look for positions. We look to see if the vertebrae is in or out of position. When the vertebrae moves out of position, we call that a subluxation. What that actually means, it means your spine's out of position. You're putting pressure on these things here. These are your discs, and they act as shock absorbers. So what happens is when you're out of position, it actually will put pressure on your nervous system. I should probably explain this better first, what your actual spine does. So 33 individual bones in your spine, and what we do, the first thing is let's explain what your spine actually does. The two main focuses or things that your spine actually does. The first thing that it does is it houses and protects this yellow structure. The yellow structure is your nervous system. The nervous system controls everything from your brain to every part of your body. It's actually a wiring. Your brain sends an electrical signal through this yellow system to every part of your body, every organ, every cell, your immune system, your eyes, kidneys, hearts, lungs, everything you think of. This carried this signal from your brain to where it needs to go, and it also is a feedback loop. So it also tells your brain what's going on in your body. The second thing that your spine does is all these big bony points, muscles attached to. So what happens is if your spine is tight or you have some tight muscles, you can actually go out of position. What happens is your spine starts to go out of position. We call that a subluxation. Puts pressure on your discs swell out and encroach the nervous system. When it starts to put pressure on your nervous system, it can actually increase or decrease that electrical signal where it goes. We call that, as chiropractors, that your body's in a state of dis-ease. Not that you're diseased or you have a disease, that your body's just not functioning properly. So what we're going to do is we're going to lay you on the table, and we're actually going to palpate and feel which one of these spines is out of position. When we get to a spot that's out of position, you're going to feel me lean on you and actually adjust you. When you get adjusted, you'll feel things pop, click, and move, or you'll hear things pop. And that's normal. That's expected. We're not breaking bones. We're not stretching ligaments. We're simply realigning your spine. A lot of people want to know, well, what's that sound? The sound is called a cavitation, and what that means is your spine is actually encased in a big balloon-like structure, and it's filled with this stuff called cerebral spinal fluid that acts as a lubricant to basically move your spine. So when we're moving you together, different molecules come together and make that sound. If you come in for any kind of pain, let's say that you're coming in for your neck, we're still going to check your lumbar spine, your low back, or your mid back, because as you can see, everything is connected. Something in your lumbar spine can affect your cervical spine and vice versa. So we're going to make sure that everything is in position. You have something called a righting reflex, meaning that your eyes are always going to be level no matter what. So what that means is your whole spine is going to curve to keep your levels how it should be. So we really can't basically adjust one part of your spine without affecting. So every time that you're in my office, no matter if you come in with, your big toe hurts or your head hurts or you have this, we're going to check your entire spine. Because again, our primary goal is not to reduce pain, is to allow that your body is in position so that your nerve system, which controls everything, functions much better. That's really the goal of chiropractic. All right, so a lot of people ask me, what causes this? That's another reason that first people come in and they'll say, oh, I understand, but, I just woke up and all of a sudden now I have pain. So for the vast majority of people, they'll understand the first thing. And we always say the first thing that causes something is any kind of trauma. It doesn't mean it has to be a major car accident. It could be something as simple as missing a step. It could be, slipping on a sidewalk. Anything like that. Posture. A lot of people now sit in a chair. A lot of kids have their necks flexed a lot with the TVs and the phones and the computers. That's usually the first thing I would say that causes your spine to actually start to go out of position. The second two things, a lot of people don't realize what really causes your spine to go out of position. And that has to do with stress. The oldest part of your brain is your limbic system. Your limbic system basically is your fight or flight response. A lot of people have heard that. Anytime you're stressed out, your body basically produces a hormone that gets your muscles full of blood to either fight somebody or run away from it. And as you can see in the spine, there's all these bony attachments. So what literally happens is your spine can actually get pulled out of position from you being stressed out. The third thing that causes subluxation also has to do with stress. We call it environmental stress. That's things that you're exposed to that are chemically altering. It could be pesticides, it could be fertilizers, preservatives in your food, excess alcohol, any of that sort of stuff, even excess sugar, causes stress in your body. And for most people, it's a combination of those things that actually starts to get your spine out of position, and then you do the straw that broke the camel's back. Something happened where you bent over and picked dog food up, you got in a fight with your wife or something else, and that stress really went, and all of a sudden, that's when you develop pain. So what we have to do is we have to look at the spine, feel where it's out of position, and gradually work that back into position to affect the nerve system. Because again, that's the whole point of chiropractic, is to allow that nerve system functioning how it should be. The nerve system is vitally important for every area in your body. A thing that I like to say to a lot of new patients is some of your thoracic vertebrae, T4, T5, those vertebrae actually, those nerves run to your heart. And what can happen for a lot of people, how they don't realize how the misfunction happens over time is, let's say that your resting heart rate is 30 beats in a minute. It means that every minute that your heart's supposed to beat 30 times. If your spine is out of position and it's putting pressure on that nerve, it can slow that signal down and you can miss 1 beat in a minute. Not a big deal in that minute, but times that by 24 hours in a day, 7 days in a week, 360, and that over time, that actually will lead to you not functioning properly. And that, again, that's what chiropractic's really about, is how you function. There's a large percentage of professional athletes that get adjusted on a regular basis. They don't get adjusted for pain. I'm sure a lot do, but the vast majority want to basically function at their highest level because their job depends on how they're functioning, and that's why they get adjusted. Again, that's the beauty of chiropractic, is it allows your body to function at its optimal level. Doesn't mean getting adjusted is going to cure everything or everything's going to go away, because again, your environment dictates how you're going to function. If you're eating a bunch of crap, if you're stressed out, you hate life and that sort of stuff, you're not going to be as healthy as somebody that really takes care of their body. So chiropractic gets you to a point, but it's not a cure-all. I'm never going to say to you, like, come in and get adjusted. You're never going to have ache and pain. You're never going to get a pain. You're never going to have asthma. You're never going to have a headache. There's a lot of factors. This really just has to do with how you function overall. And again, for me personally, easiest thing you can do is come in on your schedule and lay down on the table and have a guy or girl press on your back, adjust your spine, and allow your body at that moment in time to function at the highest possible level that you ever could be. A lot of people want to know, does it hurt to get adjusted? Is it uncomfortable? What does it feel like? It can be uncomfortable if you come in pain, but my job as a chiropractor is to figure out how much I can adjust you without scaring you away on your first visit. So if it is something uncomfortable or you can't do, we're obviously not going to cause more injury or more trauma than we need to. But that being said, sometimes after the first couple adjustments, you may feel worse, you might get sore, other areas of your spine might be sore. And the reason why is these muscles and this spine is in a particular pattern. We're working to change that pattern. I tell a lot of my new patients, if you're sore after the first couple adjustments, that's usually a good sign. That means that you're making an adaptation to what we're doing and that we're changing that sort of stuff. Eventually, a lot of people look forward to hearing that sound or feeling that because it means almost instant relief for people, or they just feel so much better. There is people that come in and they still, to this day, even though they've been with me for 15 years, they don't like the sound of it. They get nervous with it. But again, we walk you through that because for me, the more comfortable you are with me, the more relaxed you are, the easier it is for me, and the more beneficial it is for you. That's what I think, again, is what makes chiropractic chiropractor's different on every level. There's chiropractics that are really good in their technique, and they can know, hey, this person's really tight. We'll try to not trick them, but we'll try to get them to relax. And once they relax, we can make that quick adjustment, and it shouldn't be too bad. But again, can it hurt? For sure it can hurt. But it's not one of those things that is going to excruciating pain and hurt forever. It might be a quick second where it hurts for a second, but the vast majority of people really do almost feel some instant relief. That being said, sometimes after your first adjustment, you might feel worse. Then the second and third adjustment, you might feel much better. But it is a process for most people to process. That's hard for a lot of new patients to understand because most people are used to going to the doctor. They have some kind of complaint. They get a drug, and the drug either gives them some instant short relief or it doesn't. But it's something that they do on a regular basis. For us, again, we're not just focusing on your pain. Not that I'm not concerned about your pain, but my goal is to get you functioning better because when your spine is functioning, your nervous system's functioning, pain naturally starts to go away how it happens. For a lot of people, there is some instant relief. I have a lot of people come in here and they're really tight. They get one adjustment and like, wow, I feel instantly. For a lot of other people, what happens is you'll notice that the pain might not be as intense. And what will happen is after the adjustment, it goes away for a day or two and then it comes back. And what that means is your body's going through the changes. So that's when we come up with a game plan where we say, okay, look, it might take you a couple visits, and how we know that you're healing is the intensity of the pain is getting less every time, and that you're holding your adjustment or you're feeling better for longer periods of time. And that's what we kind of stretch those adjustments out. That's why in your first visit, I never tell you you're going to need 40 visits, 30 visits, 20 visits. We kind of see how your spine responds to that sort of stuff. You have to remember the true healing takes place after the adjustment. Your body heals itself. The adjustment doesn't do anything but allow the nerve system to really function at its highest capacity, and that's where really the healing happens. A lot of people might walk out of here and you might feel tight, and especially in different areas. A lot of people might come in here and say, oh, my neck is really tight, and we'll adjust their neck and the neck will feel better. And then all of a sudden, the next visit, they'll say, you know, Dr. Jeremy, my mid-back got really tight. Well, you have to remember, your whole spine is connected. So sometimes what happens is you might feel the pain in your neck, but the real issue is this thoracic spine. And I always go to the thoracic spine a lot because a lot of people sit in front of a computer. A lot of people do stuff where they're looking at the phones and that sort of stuff. So what happens is the problem really is not in your neck. It's more in your thoracic spine. I like to use the analogy of a car accident. Sometimes you're on Garden State Parkway and you're 10 miles away from the accident you're sitting in traffic. You're physically feeling the effects of something that's happening far away. It's the same thing with your spine. So yeah, you might be sore after that next adjustment, and a lot of times that second or third adjustment, if you're sore somewhere else, we kind of know that's the root of the problem, and we're going to really work on focusing that sort of stuff. A lot of people after the adjustment will tell them to ice. We'll tell them to stretch a little bit. A lot of people ask me, hey, Dr. Jeremy, what should we exercise? Should we stretch? Should we do this sort of stuff? For sure you can, but my opinion about the spine is if the joint's not working properly, there's no reason to exercise it or stretch it because it's just going to cause more damage. So what I like to do is let's get the spine working properly, and then we might come up with a game plan where I might say to you, hey, there's these stretches or these exercises. Or sometimes people have really bad patterns that they develop because of how they've been seated for so long or how they do some of that sort of stuff. And then we refer them to a physical therapist. I feel like they're experts in controlling patterns and that sort of stuff. For me personally, I'm not into that. I'm into adjusting the spine to allow the nerve system how it should be. So again, we're connected with a lot of people that could take it to the next step or that sort of stuff. People come in, we'll have the adults come in and they get a couple adjustments, they get a lot of relief, and they'll say, well, should I bring my son or daughter in? I'm hesitant. Why would kids need to be adjusted? That sort of stuff. Is it safe? Absolutely. So we adjust anybody from birth to pregnant women to, I've had women actually on the way to deliver come in and feel like, hey, I feel like if I got adjusted that it's going to speed this sort of stuff up. So it's completely safe to get adjusted. A lot of people say, well, why would you adjust kids? Why do kids need to get adjusted? Very, very simply is because the old adage, as the twig is bent, so grows the tree. Definitely, if your spine is out of position as you age, you can definitely kind of get into a pattern where your spine might be out of position. And a lot of people say, well, kids need that. Well, I've got 4 kids and they jump off the couch, they do crazy things that can actually get their spine out of position. So we like to adjust them back into position. Kids are really easy to adjust because they usually don't have the patterns of adults have. They usually don't have that stress. They don't have the tight muscles, so it's very easy to adjust children. They usually respond really well. Sometimes they're nervous at first, but eventually, and a lot of my patients will say, yeah, that's 100% true. When there's multiple kids, they'll fight to get on the table. just because they like how it feels and they know that. We do adjust infants. A lot of people say, well, why would you have to even adjust an infant? An infant, that hasn't had these traumas and stuff. Well, sometimes the first subluxation or the first trauma is coming out of the birth canal. Sometimes that can be a long process. Sometimes their head can get twisted. We get a lot of kids that have colic, a lot of kids ear infections, that sort of stuff. Again, that doesn't cure. Again, we're not trying to cure everything. Colic's not 100% just from that, but that's why the neck might be out of position, the cervical spine, and people say, wow, you're going to adjust the spine. It looks like a lot of force. We usually try to tell people how much force we use is when you test the ripeness of a tomato, that's how much you do. Kids, again, they adjust really easy. Infants don't have a lot of muscle tone, so just getting them in the right position, a lot of times that vertebrae move back in. And kids, especially young kids, they respond really well. We've had a lot of kids, chronic ear infections, we're going to have tubes. They get 1 or 2 adjustments, clears them right up. So we talk about that. Again, we get more into the natural thing. We try to tell a lot of people we're different from a lot of talking about kids as far as like nursing and that sort of stuff. We're all into basically nursing. I'm not a big fan of formula. I think there's some of that sort of stuff that has to be addressed. I think colicky kids, a lot of times it's, they're on the wrong formula, or mom's eating certain foods that could be irritating because, again, another thing that a big part of this chiropractic thing is, we call it the SAD diet, which is the standard American diet. It's the wrong diet for most people. Most people don't need that. A lot of the stuff is excess sugar, it's processed food, it's all that junk, and these kids just can't handle that, the wheat, that sort of stuff. That creates a lot of issues. So, again, I'm not an expert in that, but we'll try to correct you. We'll try to go different things. And again, we work with a lot of people that are more naturopathic doctors or functional medicine doctors who, will say to you, hey, look, your spine's doing really good. You have all these nursing issues or your kid's really colicky. You could get tested. You could figure out, that's not the right formula, that sort of stuff. So another good thing about me being this for so long is I do have a lot of contacts that we can get you into and say, hey, chiropractic might be the answer for this, but to go to that next level, you might need to see a functional medicine doctor. You might have to change your diet. You might have an allergy test to a certain food that could be irritating you. Yeah, so a lot of people with the internet, YouTube, that sort of stuff, it's funny you say that. I have a lot of patients ask me, I was watching YouTube videos and I saw this guy put this thing around their neck and they pulled on their neck and they did this and they had another guy's got a mallet and he hits people with mallets and that sort of stuff. I never want to bash anybody as a chiropractor, but you have to know chiropractic literally means hands on the spine. So the first thing I have to say to everybody is you should, as a chiropractor, you should be getting adjusted by your hands being on the spine. A couple other things. So when I went to chiropractic school I graduated in 2004, there were certain moves that were taught in school that these are the moves that are allowed, that have been approved, that have been that you're trained on and that you're taught on. So the reason that I don't do some of these crazy moves is first, you're not trained, at least when I was in school, you're not trained on any of that sort of stuff. I don't know if they're made up or you've taken a seminar, you've done some of that sort of stuff. So we don't do those sort of moves. I'm not saying that they're bad, but my personal opinion is I'm not an expert in that. I don't need to do that sort of stuff. The second thing is I get really great results without doing that stuff. I think some of that is sensationalized. I think some of it can be. I think there is great moves that can be that sort of stuff. Those people may be experts in that. They may be doing it for YouTube. I'm not sure. But no, I'll never put a towel around your neck. I just don't think it's safe. I think the ones that I've seen, it's too much. It's a very high speed. It seems like a high amplitude impact. And for me personally, the less force that you can put into the spine to move the vertebrae, that's when you know you're an expert chiropractor, right? You don't have to do a lot of movement. When you know what way the spine is out of position, you know exactly where it needs to go, and that quick, little, easy force, that's what you want. A lot of people, again, go into that sort of stuff. I don't know where those guys were actually trained. I don't know if, again, it's a seminar. But when I was in school, those moves, they weren't used. Some of them were possibly banned. So I don't like to open myself up to any of that sort of stuff. I don't need to do that because I get great results without doing some of that stuff. Another question people ask me is the sound. Does the sound dictate how good of an adjustment you got? Absolutely not. Absolutely not. As a young fledgling chiropractor, you're not that good. You do have some experience, but a lot of times you'll basically base how an adjustment is by how it sounded.
as you age and you become a really good adjuster, you don't even hear it. You just feel how that bone moves. So yeah, there's definitely times where I think I've given a great adjustment and people may not hear it, but I know that it actually moved, and that's what it is. So the sound really doesn't dictate. Other people just make louder sounds, and again, sometimes I feel like on YouTube it gets exacerbated. People do that, or they'll get certain patients that are just louder. I have certain patients that are just louder, and I know right now if I wanted to make a great video, I could get them coming in and we could make a bunch of sound. It doesn't mean that they're getting a better adjustment than anybody else. So the sound doesn't dictate that you're getting a better adjustment. So here's a bunch of things. A lot of people ask me about adjusting different things, cracking your knuckles, that sort of stuff. So cracking your knuckles is completely different than adjusting your spine. Your spine has a lot more articulation. A lot of times the knuckles, I've heard the old adage, you're going to crack your knuckles, you're going to get arthritis, that sort of stuff. I don't believe that to be true unless you do that 1,000 times a day. I think a lot of times that's ligaments in there that are moving around. There probably is some of that sort of stuff. I don't think it's a bad idea to do that. I just wouldn't recommend doing it 1,000 times a day, every day. A lot of people ask me about self-adjusting, adjusting your spine, that sort of stuff. It all depends on how you do it. A lot of people will say, what about my wife walking on my back? It feels really good. It can be good, and I don't want to be fresh, but it also depends on how heavy your wife is. If your wife is bigger and that sort of stuff, you can press on somebody's spine and move them in the wrong position and can make it worse. And I do have people that do come in here that actually were self-adjusting and made themselves worse. I also have people that will come in and say, hey, Dr. Jeremy, I was walking down the street and I turned my neck and my neck popped and now I feel great. Yeah, your body's designed to self-align itself by movement, by stretching, by exercising. That's why we're really we like people that move. We like that sort of stuff. So your body's 100% designed to move itself. Where we come in is when you're out of position and your body doesn't allow that, that's where we come in as experts and we make that correction. Self-adjusting. Can self-adjusting be good? Maybe. It depends on how it's done. A big thing that a lot of people do, especially a lot of young kids now, is we like to call it like a long axis traction, or basically what they do is they take their hand, they put it on their chin, and they move their chin. A lot of times what happens is you feel good when you do it, because anytime that you hear that sound, your body releases endorphins. So endorphins are basically they're natural painkillers. So what happens with a lot of people is they do that, they feel really good, but then 20 minutes later they got to do it again. And what they're doing is, you have 7 cervical vertebrae. A lot of times when you're doing a long axis traction, you're basically moving a vertebrae that's in position further out. You have to remember, these vertebrae are coupled together. So what happens is, as you're moving one further out of position, you're technically moving the one that's in position out of position. And that's why a lot of times, and a lot of patients will tell me this, once I started doing it, I had to do it more on a regular basis. Where we're different is, I'm not going to use your chin. I'm going to find which one's out of position. My finger's going to hold that one, and I'm going to hold the other one, and I'm going to slide that one back into position. And again, that's what makes us experts at this sort of stuff. We're the only people trained to do that. I know there's some other professions that I've heard people go to and they lean on my back and they do that sort of stuff. They're not experts in it. They might make that sound, but chiropractors are the only ones that are trained to do that. They're the only ones that are to do that. It's kind of like me. I've taken a couple classes in chiropractic school. They make you take some physical therapy classes. I have no idea. I would never put something on your back. I'm not going to talk about movement patterns. I know what they are, but I'm not an expert in it. And my opinion is you need to see an expert if you're going to do any of that sort of stuff. So same thing. You come in here and you say, hey, I've got this and this. If it's out of my scope of practice, if it doesn't mean this, I'll refer you to a great physical therapist. I'll refer you to a great orthopedic. I'll refer you to a great acupuncturist. But yeah, me personally, I don't think anybody should be adjusting your spine. Now, there's people that say, well, they can manipulate the spine, that we're doing manipulations. I don't like to use manipulation. I think it's a dirty word. I think it's taking advantage of people. We like to use adjustments because what makes us unique and different is we know which way it's out of position, and we have a direct goal of that. We're not just trying to mobilize that joint. We're trying to move it back into position to allow the nervous system to function properly so that you function at your greatest potential. And that's really what this is about. Chiropractic function at its greatest potential, your whole entire body. I talked a little bit before about your spine carrying the your cord, which is basically an electrical signal. A lot of people don't realize this, that there is an electrical signal that runs through your brain that goes everywhere. So when that signal is impeded, it really kind of affects that. We are basically human beings. We're light energy. That's what it is. Energy flows through this. So when you're out of position, that energy, that signal, whatever you want to call it, is not getting it where it needs to be. When you're getting adjusted, you're just allowing that body to function at its highest potential.